Good evening,
Hi,
doctor.
good evening. Nice to see
Welcome.
all of you all and all the birthday celebration. I'm glad the session in the morning went on very well with Gavin. So thanks to Gavin
Yes.
and all the work that you're doing. In fact, everyone really appreciates the work that you all do at the Memory Cafe. On the weekend, I was at the National Alzheimer's Conference, and I got a chance to speak about the Memory Cafe and the work that you are doing. And they were really fascinated about everything. So really, three cheers to all the core committee members, the pillars of the Memory Cafe, who are putting all the effort to put this in under the captaincy of Sheldon. And congratulations to all of you. Memory Cafe wouldn't be successful if it wasn't for the participants of the Memory Cafe. So it's because of you who make it successful. Really, it energizes all of us to do things more and more. The one take-home message, and that's what I wanted to share with you at the National Alzheimer's Conference, is that when you're dealing with the problem of dementia, they said don't deal with it cognitively, deal with it emotionally. And that's somewhere where things are missing. We're trying to say, okay, if there is 1+1, so it's 2, and so that's how we solve things. It needs to go beyond that. We need to deal with it with emotion. And when we understand what is the person, that there's a person who has the disease, we need to address the person and try to make the person happy and not really try to only treat the disease. So that approach really makes a big difference. So it's not about the brain, it's about the heart that really makes a difference. And that brings me to the sip of the day, because yesterday was World Heart Day, 29th of September is observed as the World Heart Day. And the theme is use heart to know heart, the use heart for action. And how do we do that? I thought I'll just split the word heart for you all to keep, so for you to just keep in mind few pointers uh, why we need to keep this at the heart of the matter and really get to the heart of it. Uh, First thing is H, which tells us about a healthy diet. There's no substitute for healthy diet. So you need to keep analyze the diet that you're having, analyze the food that people in the family are eating. It's not about what you eat now; it's what you've eaten many years ago, and what people, the youngsters are eating, and they are influenced by so many things. And the food is changing, and food habits are changing. The timing that you're eating, the content of what you're eating is changing. So one has to be careful of this because everything is affecting us. We see a change in the occurrence or incidence of heart diseases that used to occur in older people at the age of 60, 70, and 80, now is happening at the age of 40. You have 40-year-old, 30-year-olds who get a heart attack. So there is something that is going wrong. H is telling us we need to change our diet. We need to have a healthy diet. E, what Babita keeps on telling you, exercise, exercise, exercise. It's very, very important for us to exercise. People tell us to count our steps. Now you have all kinds of gadgets and wearables that count your steps, 10,000 steps in a day. See how you can do that. But exercise, if there's a chance, if you can climb up, use the stairs instead of using the lift, try to do that. See how much you can. Don't overdo it. Do it small and then increase it. Do it in steps. Don't just, if you've not exercised, don't just go next moment and climb up some 7 flights of stairs or something. It'll make it a bit difficult for you. So be careful, be considerate to your heart, but exercise is something you have to keep in mind. H-E-A is avoid smoking. Those who are not smoking, please don't smoke. There's nothing good about smoking. A is also telling us to avoid stress or manage stress rather. So if you are stressed, many of us could be stressed, various factors that cause stress in us. We need to know how to deal with stress. And time and again at the Memory Cafe, we teach people how you deal with stress and getting involved with people, speaking to someone else. That is a best stress buster. Be there. So it shouldn't be that, okay, I'm stressed today, I'm depressed, don't feel like joining the memory. No, it shouldn't be that. If you're stressed, then please join the Memory Cafe because that's going to be a stress buster for you. So be there. R is regular checkups. We should not miss out on the regular checkups. So at your age, if people above the age of 60, then an annual checkup or 6 monthly checkup if you have any risk factors. If you don't have any risk factors, then an annual checkup, at least check for your sugars, check for your cholesterol, check your blood pressure. Simple tests. You don't have to do sophisticated tests. Simple tests will give you an indication if anything is going wrong. Check your weight, check your waist. But these are things that are important because these will give an indication of whether you are at risk of developing heart disease. And the last alphabet, which is T, is take your symptoms seriously. And that's where things go wrong. We have a chest pain, left-sided or center of the chest, very squeezy type of pain. It's a very severe pain that you could get if it's a heart attack. Now, remember, in people with diabetes, the nerves get affected. Because of that, the sensation of pain gets numbed. So you may have a heart attack, but you may not get that severe pain that other people get because the nerves are affected in diabetes. So that you could end up having a silent MI. So you're not feeling well, feeling uneasy, feeling dizzy, sweating suddenly. Uh, these also could be signs of a heart attack. And you cannot wait. You cannot say, okay, now my children will come in the evening and then I will tell them that I'm not feeling well. Time is very, very precious in case of a heart attack. You need to be in a hospital that can reverse a heart attack within an hour. So that's called a golden hour. So you have to be there fast. There's no point of you going to a general practice. If you think it's a heart attack, please go to a more advanced hospital rather than spending time going to your general practitioner, getting a doctor home or anything. You're just wasting time. Call an ambulance immediately, as soon as possible. Try to get to a hospital that can give you the medications required to be able to reverse the heart attack. So keep that in mind. There are 20 million people who die of heart attack or heart related diseases every year. That's a big number, 20 million people. But the good news or bad news is 80% were preventable. So it means that if we put our system in place, if we are a little more disciplined, we can actually prevent a heart attack. And that has always been our message. Prevention is always better than cure. There's no point getting a heart attack and trying to take measures, then stopping smoking. A lot of people tell me, no, doctor, you don't know how it is, and it is your smoking, you have to smoke, you can't leave it. So I tried leaving, it's so difficult. They get a heart attack, next they leave smoking, they leave alcohol. You can leave alcohol, you can leave smoking. It's just up in your mind. You just need to you need to take action. So that's what the whole theme is about. It's time to take action. And that's my sip for the day.
Thanks, doctor.
Most welcome.
As our heart beats, it goes tick, tick, tick. I think we are sitting sometimes on a little time bomb, maybe a tick, tick bomb.
No,
if you're
don't
not
worry,
very careful, if you're not careful. See, the symptoms that you have given us, I think we have to take them sometimes seriously. The golden heart, the ticking time bomb, the ticking time bomb. Okay.
Good.
Thanks so
stay
much.
happy, keep laughing, everybody.
Yeah, I think that will keep all heart attacks away. So yes. I think be happy. And I think
laughter is the best medicine. But if there is pain, just go to a doctor, okay? Don't just laugh about it.
Sure. We'll keep laughing, doctor. It will fly away. Hopefully. Okay.